Hi everybody, this is Selena. I just wanted to give you guys a quick video update and an apology. It's been a while since I've made a video. Wanted to let everybody know part of the reason why I haven't done a video is I've been involved on a website, or not a website, but a Facebook group, and I've posted a lot of videos there, so I apologize. Everybody that's been following me here kind of got the short end of the deal. So let me try and catch you up, and it may take a couple of videos to get everybody caught up because I don't want to post like a 30-minute video. So okay, so the last time I posted, I was getting ready to go to Mexico. Had made my mind. I had seen my local surgeon, and was within, I think, a couple of weeks of leaving for Mexico. So I have been to Mexico. I have had my surgery, and I'll tell you about my pre-op, and then I'll tell you about my surgery, and then my next video I'll tell you about the last 3 weeks since surgery. So pre-op was kind of slow. I wasn't losing a lot of weight during the pre-op like everybody else in the group was, and again, I've been real involved in A Lighter Me's Facebook page, so it is a tremendous help to have that kind of community to bounce things off of. So I'm kind of basically talking to you about my experiences with that group. So watching everybody else that was going to have surgery around the same amount of time, I wasn't losing as much as they were. But in all fairness, you can't judge yourself compared to somebody else because you don't know exactly what their BMI is, and everybody's metabolism is different. My BMI wasn't terribly high. I only needed to lose about 80, so it wasn't fair for me to compare myself to somebody who needs to lose 160, because of course in the very beginning they're going to lose a lot more, because there was a time I had to lose that much weight, or not that much, but there was a time I had to lose a large amount of weight, and it does come off faster in the beginning. So with that being said, my slow weight loss probably is normal. So I think I lost a total of 8 or 9 pounds before surgery, which is not much. So it might have been 12. I'm sorry, that number just kind of has floated by me. But so somewhere between 9 and 12 pounds before surgery. And so then I took my cousin and we went to Mexico, and we met up with A Lighter Me. Their coordinator picked us up at San Diego and took us across the border, and we went to the Marriott the first night and stayed there, and the group was extremely nice, professional. It's a fine-tuned machine over there, how they do this business and the surgical part of it, fine-tuned. They know exactly what they're doing. And the next morning we got up and we went over and did our blood work, and then basically checked on into the hospital because the surgery was going to be later that day. Dr. Ortiz did my surgery, and he had a lot of surgeries scheduled for that day. He was getting ready to leave to go on vacation, so he had squeezed in a lot more surgeries probably than a normal surgical day. I had the gastric bypass that day. I was not nervous, was not uncomfortable. Everything was clean. Everything was exactly the way they had described it. The nurses were well enough speaking English that could communicate. I only had a couple of minor situations where I had to really work with them on a few things, and one of them was more about a personal need than it was any medical need. My cousin that went with me was bored silly. It was a lot of downtime for somebody to be hanging out in the hospital with you, but she did good. She was a trooper. She's her husband passed away a year ago, so she spent a lot of time in a hospital, so she was prepared for the long days in the hospital. Me, on the other hand, I was not. Surgery went as scheduled. Everything was fine. I had a touch of nausea when I first come out of recovery or went into recovery. I do remember throwing up, but that is a fairly normal response to anesthesia. I didn't have any ongoing nausea, and I have a very high tolerance to pain, or don't require as much pain meds, because I had to tell them to cut me off the pain meds. They were scheduled every 6 hours, and after a day and a half, I was like, get me off this stuff, because I'm just a loopy goofball. So they were able to take me down off. They had to get a doctor permission to do it, and he came and made that happen. And with the gastric bypass, they make you stay in the hospital one day longer for observation. And I was miserable. I wanted to pull the tubes out, unhook the IV, call a taxi. I'm out of this place. I had a hard time that last day. I suffered a tad bit of momentary depression. I was not happy about being in the hospital. I felt like my recovery was being slowed down because I was in a bed that wasn't comfortable, and I was a place I didn't want to be at that point. I bounced back a lot quicker than most people do, so I technically should have went on and went over to the Marriott. However, they're not set up to do that, so they weren't paying for an extra day at the Marriott for me, so I had to stay at the hospital. But the next day, I had my bags packed. I had my hair ready to go. I was standing at the door waiting for the doctor to come in and release me, and I drug my suitcase. It's not like a U.S. hospital where you get wheeled out in a wheelchair. You walk to the door, and I had a suitcase on wheels, and I drug it, was ready to go, was standing there, come on, let's go. So, and then we went on over to the Marriott, and it's amazing what a luxury hotel will do to make your spirits a little better. The beds were great over there. They were top-notch facility over there. And the food, of course, you're still on a liquid diet, but you had a few more options. You had better tasting broth. You had other flavors of Gatorade. So, it was a little more comfortable for the situation. It was tough in respect to communication to my family back home. Everything had to be through the internet, so you wouldn't be charged crazy, outrageous fees. And so was communicating through Facebook Messenger, which was, a little tough. Would have liked to have been able to, hear their voices and talk to them that way. My mom was kind of a worrywart, and she stayed in contact with me as much as she could, or as much as I could handle giving out. That pain medicine messed me up for a day or two, and I didn't want to talk to nobody, so that had her worried just a little bit. So stayed a few days at the Marriott. Their program over there, they take you and go do a day of shopping, which was fun. The more I got out, moved around, the better I felt. So so that part of it is done. We flew home. That was a long day. And we flew into Phoenix, and I'm so glad that I lined up having wheelchair assistance from one gate to the next, because it was almost a 2.5 mile walk from one area of the hospital or airport to the next area that we needed to catch our flight. And we had like a 2.5 hour layover, so we just had them wheel us into that area, and then we piddled around, looked at the gift shops or whatever, and then flew the last flight of our flight. It was pretty. I'm not gonna say it was uncomfortable flying or anything. It was tight. Every seat in the airplane was full, so you were kind of scrunched up next to everybody. I got home. I had a couple of rough days. The first few days coming home. Trying to figure out how to balance this new meal plan. I was sick of fluid or liquid diet by that time. I was, your body can't take you can't eat anything, even if as much as you want to. If you eat something that's not in your weekly program, it's going to be painful. It's going to hurt. So, you can't do anything about not liking what you're eating. You just have to flavor it, do whatever you can, however you can. So basically, I've been home for 3 weeks now, and I have lost, I have lost about 23 pounds from pre-diet or pre-surgery to current. Right now my weight is 196, and I think when I left it was like 208 or something like that. So it's 196 now, and weight is slower to come off. Everybody told me it would be. I didn't believe it. I thought, you're full of nonsense. It'll come off because you do this malabsorption process to your body. It'll come off. But for some reason, revision patients do lose at a slower rate. However, there's an upside to that. The slower you lose, the better your skin will adjust. The slower you lose, the more likely you'll keep it off. I mean, we all have heard those things, so you have to look at the good with the bad. I feel like I'm working really hard to lose the weight with what I can for this time frame. I mean, I'm not at the gym yet. I'm sticking somewhere in the vicinity of 800 calories a day probably, and that's really all I can take right now because you're limited on how much you can eat, of course. Protein, push the protein first, watch the carbs, and A Lighter Me has a really good dietary schedule set up. I do like their numbers. It's basically 100 grams of protein a day, and stay under 55 carbs a day, which can be tough, so you have to really pay attention to your carbs. And we've been taught for years that fat is bad, fat is no good, but in all honesty, you need fat into your diet. You have to have the natural fats in order for everything to work right, in order for you to be burning what you need to be burning. So you have to stay under 40 to 45 grams of natural fats, and that's like butter, real butter, cream, like whipping cream, but not sweet. You're using it in place of like milk, and you can add water to it to get the right consistency, or guacamole or avocado, but you make guacamole with it. So those natural fats are highly important to have in your diet because it is one of the keys to losing weight. And I noticed that if I don't balance those numbers right, I don't have a weight loss. I won't have a loss for the day. I balance those numbers right, and I mean it's precise. When I balance those numbers right, I wake up the next morning and I'll have 3/4 of a pound gone or a full pound gone. So there's some there's some truth to it now. Anyway, so I am losing. I have a tough time seeing it, but my family says they see it in my face and my neck. 23 pounds is, I consider, a significant amount of weight for 3 weeks. So maybe four, well, let me take that back. It's probably close to 5 weeks that I've lost 23 pounds. So it's a significant start. I have about 65 left to go. And then I'll be at about 125 to 130, and I'm only 5'1", so that's a very good weight loss for me. If I get to 130, I'll probably be happy with that. It's been a long time since I've seen 130. I'll probably feel anorexic at 130, so we'll see how it goes. I'm not dead set on those numbers. It's going to be wherever my body is comfortable, I'm sure anything under 160 is going to be new for me. I haven't seen 160 for 20 some years, because I was probably 125 pounds when I got pregnant with my first son at age 19, and I don't know that I ever seen 160 and below since then. So it'll be a whole new me after I get down to those numbers. So anyway, that's kind of an update on what's happened. I said I would make it in a couple videos, but probably not. I think I caught everybody up. Food-wise, you just got to dig in and look. You just got to read labels. You got to look at recipes. It's all about taking control of what's going into you. No longer do you just go through a drive-through and just get something because you're hungry. It's all about pulling up an app and looking and seeing if you can have that. I know that there's been a few times I've been caught out, and it's either you eat something or you're just going to go down because you don't have anything in reserve. So there's been a time or two that I have gone to like Chipotle, and it's almost funny. You got to fight with these people to get them to understand. Don't put all that other crap on my food. Like I'll get like the steak that's kind of pulled apart. I'll get the steak, and I'll ask for cheese and lettuce and just a little bit of guacamole on the side, and some of the salsa, because the salsa is very 7 or 8, 10 calories depending on the size. But the portion sizes are the part that gets you. You have to tell the people, don't give me that much, and you realize you're paying for a full portion even though you're not going to eat it. I would rather them keep part of my food and use it for another customer than waste it. So I don't mind paying $8 or $9 for a portion that's I'm still going to have leftover because I can't eat it, but a smaller portion of the right food. So I've done that a time or two, and it did kind of boost my calories up. So you need to be very cautious about eating out. But it was that or go without. And after weight loss surgery, going without is not a good option. You have nothing in reserve right after surgery. With that being said, vitamins. I'm on multi-symptom or multi-purpose vitamins, chewables, and I take biotin. I take 10,000 milligrams of biotin. I want to hang on to it, so the biotin is going in early now. And I also take an antacid. Now, the trick to the antacid is an antacid also mimics itself, or the acid in your stomach also mimics itself as hunger. You get this, oh, I'm starving, and more than likely it may not be that. It could be that the acids are churning and it is creating this trigger that says you're hungry. So staying on top of that, taking an antacid, 40 milligrams of Prilosec, or I'm sorry, I can't remember the actual medical term for it, but anyway, you stay on top of it. You take it I take 2 pills, which are 20 milligrams apiece, so 40 milligrams a day, and that kind of helps keep that hunger feeling away, and it does. I don't have, I'm going to tear something up, I'm hungry. Now, put myself in a situation where somebody's cooking fresh baked cookies, it might tear me up. It might trigger that inside your brain, but I'm not going to put myself in that situation. I'm going to remove myself from it, because it's just like any addict. Until you're strong enough to resist it on your own, sometimes you don't need to be around it, and that's how I have to look at it. This is truly a food addiction for me. I eat for everything. I celebrate with food. I mourn with food. It's just the way I was raised. So I'm going against everything that has been natural to me, and going at it again a second time with this new surgery. So everything, for the most part, has gone as scheduled, planned as as it was supposed to go through. No surprises, no complications. I've had no complications. The surgery's taken me a little longer to get over feeling like I've had surgery. In all fairness, it was a much more invasive surgery than the first time. The sleeve was a quick nip tuck, pull it out, stitch it back up, here you go. Bypass is completely different. Bypass is cutting stuff and re-sewing things, and I'm sure he cleaned out some scar tissue in there because I've had several abdominal surgeries, so I'm sure it wasn't easy, and my stomach feels that way. So I can't think of anything else to add to it right now. I just wanted to kind of update everybody. Everybody's kind of wondered where I'm at. I apologize. I'm also, remember everybody, I'm taking 3 college classes right now too. So I'm taking a chemistry, a environmental law class, and some English class. So my time's pretty limited right now, and I feel like I'm either got my nose in a book or I'm studying something for weight loss, and I apologize I haven't had a video lately. So I hope this video will help everybody. Ask questions. I'll answer the best I can. Be patient. It may take me a little while because I'm really studying hard to finish up some of these classes, so that it comes first. But everybody take care, and I hope that my videos help you, and I hope that you follow up with what you need to do for surgery if that's what you choose to do. If you have any nutritional questions, I'll help you the best I can. Have a great day.